It's an honor to be sitting here with Dr. Dean Smith, Ophthalmologist and Co-Medical Director of TLC Mississauga. Welcome to Insight on Eye Health.
Thank you, Marg.
It's been a pleasure being here today in the clinic with you. And when we're talking about cataracts, and when a patient is referred to you, what does that experience look like for a patient? What can they expect?
Well, so the patient usually has a problem. They're usually having trouble with their vision, and they're referred usually by their own eye doctor. And they come to the clinic, they get some testing done, I examine them, and then basically I inform them as to their condition. So I tell them how bad their cataracts are. I tell them about any other eye problems that I see, particularly things like dry eye or macular degeneration. And then we get into a discussion about what we're going to do about it.
Now, I can imagine that once you hear that there is a cataract and perhaps that there's a surgery pending,
right,
fear sets in.
Yes.
How do you eliminate some of that fear for your patients?
Well, the most important, well, there's a couple things. First of all, the procedure is really painless. People don't like the idea of having things done with their eyes, but it really is painless. It's quick, and they're sedated. There's another doctor, an anesthesiologist. They have an IV going, and we can give them as much or as little as they need. So
that's comforting.
Yeah.
Now, when it comes to choices, I mean, there are many when it comes to an implant, for example. How do you help guide and educate your patients so that they make the best decision for them and their lifestyle so that they get the best outcome after their surgery?
Well, there's a couple parts to that, Mark. First of all, you look at what their vision has been like. You know, what sort of correction they've been wearing, whether they're nearsighted, farsighted, astigmatism, and so forth. And then you inform them about what types of corrections can be done. So simple distance vision correction is usually pretty straightforward. Most people can get that. But there are ways of giving people both distance and some near vision now.
Oh, so
yeah.
that's fantastic. And can you briefly speak to coming to a private clinic like you have here at TLC versus the other options for patients? Can you speak to that as well?
Sure. So all of the options for patients these days are quite good. So the surgeries that are done that are funded by the government are very effective, and they get all of the benefits of the most recent advances in the procedure and so forth. So, and generally with that, we can give people pretty good distance vision correction, or if they were nearsighted to start off with, a good nearsighted correction. Now, some people, whether they have astigmatism or whether they want both distance and near, that requires additional correction. And so that's why clinics like this offer additional services, basically additional testing, special feature lens implants, additional follow-up afterwards. Sometimes people need a little tweak or a touch-up treatment afterwards. So you have to be able to offer all of those things in order to offer the upgraded service.
Well, thank you. I know that our team has just been amazed at watching you work here in your environment.
Well, thank you.
And I know that all of our viewers at home will be grateful for the education that you're sharing and the amazing work that you do. Thanks for joining us.
Thank you very much.